Hello, my dears. This is Menopause Taylor bringing you the state of menopause in the world today. Are you ready for more options to reduce your risk of heart attack? As you know, I cover every category of options and I present them all with great enthusiasm. The way I see it, the more options you have, the better. And I don't think the category matters as much as meeting your goals does. So I deliver as much information as I can to enable you to meet your goals. So right now, we're working our way through the great big unit on heart attack, and I've already covered the management options in the categories of diet, lifestyle, vitamins, minerals, and supplements, herbs, and hormones, all with the goal of reducing your risk for heart attack. This means that there's only one category left, and that is the non-hormonal medications. So that's our topic for today. And this podcast is important because you never know which options you'll need to consider for lowering your risk of heart attack. And the more you know about all of them, the better off you're going to be. Education is like that. The whole idea is know as much as you can so that then you can use all your knowledge to make good decisions. When you only know one thing or another, you're only in one camp or another, you only believe in one thing or another, you really sabotage yourself and you make it so that you're not aware of options that you might want to take advantage of if you only knew about them. You see, the scenario for a whole lot of women at the time they become postmenopausal is one in which they're a bit overweight and gaining more. Their cholesterol studies are less than ideal, often indicating a high risk of heart attack. They want to change their diet and lifestyle habits to lower their risk of heart attack, but they know that that's going to take time, persistence, and determination. They already use the vitamins, minerals, and supplements that can help, but their blood pressure is a bit high, and they don't necessarily want to take HRT, or they take HRT but their heart attack risk is still high for other reasons. And their doctor says that they really need to consider a lipid lowering medication, something to lower the risk of heart attacks, regardless of other measures, simply because they need to make a big difference quickly. If you found yourself in such a scenario, would you know everything you need to know in order to make a wise decision about whether or not to take a lipid-lowering medication, or whether to do something other than a lipid-lowering medication? Or would you feel the need to go to the internet and consult Dr. Google? The vast majority of women would be on Google in a heartbeat. But Dr. Google is so inadequate and inaccurate. It's mostly advertising. Very little of what you find on Dr. Google is accurate. And that's why you should pay attention to this podcast, because I'm going to save you a whole lot of head scratching. There are three basic categories of non-hormonal medication for lowering your risk of a heart attack. They are the statin drugs, aspirin, and blood pressure medications. So I'll go through each of these and teach you the basics with which you can tailor the details to your personal situation. And we'll start with the statin drugs. Statin drugs are the gold standard for lowering one's risk for a heart attack. And the first thing you need to know about them is how they work to accomplish that goal. I've taught you before that your body makes cholesterol. And statin drugs work in one of two ways. First, they stop the production of cholesterol in your entire body. And second, they help you break down and absorb some of the lipid buildup in your heart arteries. As a result, statins lower your total cholesterol, lower your lousy LDL, lower your triglycerides, and raise your healthy HDL. And they stabilize the lipid buildup in your arteries so that it doesn't get worse. And in so doing all of those things, they decrease your risk of a heart attack. So I guess you could say they kind of sort of mend a broken heart, like that song, how can you mend a broken heart? These drugs have been around for a long time. You'll actually probably recognize a few of their names. Here's a list of the statin drugs. There's Lipitor, Lescal, Mevacor or Altacor, Livalo, Prevacol, Zocor, Vytorin, Crestor. Recognize any of those? Bet you do. Of course, mending a broken heart is not an easy job, and nothing is magic. So these statin drugs do not completely erase your risk of a heart attack entirely, but they work well to lower it. So how well do they work? Well, they decrease your risk of heart attack by an average of 25 to 35% in general, and by as much as 60% for some people. All told, these are pretty significant decreases. Putting it another way, statins prevent one heart attack in every 50 people. And put even another way, statins lower cholesterol by an average of 1.8 millimoles per liter. They are so effective that statins are the most prescribed drugs in the US and many, many other countries. Most statins consist of a pill that you take by mouth once a day, and you can take some statins at any time of day, and others require you to take them in the evening. So now you might be wondering how you know if you should take a statin drug. Do you remember what I've taught you about guidelines? Almost everything in medicine has guidelines, and the statins are no different. When it comes to the guidelines for taking a statin drug, if you meet any of one of the following situations, your doctor might recommend a statin. 1, if you've been diagnosed as having any kind of heart disease, this might mean you've had chest pain. It might mean you already had a heart attack or a stroke. So any kind of heart disease. Number 2, if your lousy LDL is greater than 190 milligrams per deciliter in the US or greater than 4.9 millimoles per liter in Europe or Canada, you might be recommended to have a statin drug. Number 3, if you are between the ages of 40 and 75, have diabetes, and have a lousy LDL between 70 and 189 milligrams per deciliter in the US, or a lousy LDL between 1.9 and 4.1 millimoles per liter in Europe or Canada, you might be recommended a statin. And 4, if you are between the ages of 40 and 75 and you have a lousy LDL of greater than 100 milligrams per deciliter in the US or greater than 2.6 millimoles per liter in Europe or Canada, and you have a greater than 7.5% risk of having a heart attack in the next 10 years, your doctor might recommend a statin drug. Now, you know that everything has risks. As with everything in medicine, your doctor's job is to weigh the benefits of taking a statin drug against the risks of taking a statin drug. And you should only take it if the benefits outweigh the risks for you. You know, everybody focuses on side effects, but side effects and risks are not necessarily the same thing. Risks are more profound than side effects. Risks are the big ticket items that you incur in order to reduce your risk for something else. For example, by taking estrogen to reduce your risk of heart attack, osteoporosis, and Alzheimer's, you increase your risk of uterine cancer. But side effects are more minor. Side effects are the nuisances you have to tolerate in order to gain the big benefits of the drug. So a side effect of taking estrogen is breast tenderness. So let me tell you all about the side effects of the statin drugs, because every medication has side effects. Side effects are things that may occur. And most side effects only occur in a small percentage of the people who take the drug. And most drugs have mild, common side effects. Some have uncommon, more serious side effects. So here are the side effects for the statin drugs. The mild, common side effects include headache, difficulty sleeping, skin flushing, muscle aches, tenderness or weakness, drowsiness, dizziness, nausea or vomiting, abdominal cramps, bloating or gas, diarrhea, constipation, and skin rash. Less common side effects include memory loss, mental confusion, high blood sugar that occurs in 1 out of every 255 people, type 2 diabetes, and nerve damage. And the really uncommon serious side effects that constitute risks of using a statin include muscle inflammation, which occurs in fewer than 1 out of 10,000 people, and liver damage. But some of those things sound awful. The key is this. Would you rather have one of those side effects, or would you rather have a heart attack? That is the kind of balancing of benefits against risks that you have to do in considering a statin drug. And next, you need to know what to expect in terms of how long you would take a statin drug. Statin drugs only work while you continue to take them. They aren't like antibiotics that you take for a while and then stop. Most people who start a statin drug will likely take it for the rest of their lives. Now, you can do other things that make it such that you no longer need the statin drug. It's just that the majority of people who need a statin drug do not or will not do those other things. The alternatives include drastic diet and lifestyle changes. And unfortunately, our society is one with a quick fix mentality. And the thing that's different is that a statin drug can act more rapidly than changing a lot of diet and lifestyle habits. Those are things that change slowly. There are drastic changes that require a lot of substitutions in your life. Many people have the misconception that they can take a statin drug instead of adopting good diet and exercise habits. See, that's not the way it works. The higher your risk for heart attack, the more you need to do everything possible to lower your risk. But if you're on a statin drug and you want to stop it, you don't just stop it suddenly. You first do the other things that can provide some of the same benefits as the statin drug. For instance, first you adopt a 100% plant-based diet that is low fat, high fiber, and low sugar or no sugar. And then you start exercising regularly in a way that benefits your heart. Third, you take all the vitamins, minerals, supplements, and herbs that can lower your risk for a heart attack. And depending on how early you are in your postmenopause, you might consider taking HRT. Then, after you've done all of that and you're seeing results and you've got new routines and you've got a new lifestyle and you're starting to have a healthier way of life, then you might lower the daily dosage of your statin a bit, or you might switch to a different statin drug. As you can see, that's a lot of things to do, but the statin drugs are not the only way to mend a broken heart. They're just the ones that everyone uses because they're the quickest and doctors are handing them out like crazy. They are the most popular drugs anywhere now because so many people have heart disease and people want to quickly do something about it. The second category of non-hormonal medications for lowering your risk of heart attack is aspirin. And it lowers your risk of heart attack by thinning your blood just a little bit. Most people just take a baby aspirin every day. The most common side effect with aspirin is stomach upset. And the most serious is gastric bleeding. You shouldn't take aspirin if you already take any of the following medications, though. If you take any other blood